As we're heading into the end of 2024, we asked DSO executives and dentists what they're focusing on.
So for the next 6 months, we're really dialing into clinical efficiencies. How do we get more out of our teams with our patients, more out of the patient visits for each patient that comes to see us? So we've been focusing on same-day care initiatives. How do we measure it? How do we monitor it? How do we increase it?
So the Smilist is currently piloting a couple of AI platforms for clinical diagnosis. It's still underway, but it's amazing just the results that we're seeing so far.
We have a lot of imperatives we need to go execute in the remainder of 24. We're completing our rollout of Dykema, PMS system across all of our practices, our general GP practices, and then we're going to be on to Cloud 9 for ortho right after that. Anytime you can make the company more efficient, right? Because you have one system that you can utilize across all your practices, it just makes it easier for everybody else to execute in that. And then when we think about staffing, doctor days, all those things, to have a single point of view of the world, which you can get when you have one system, it just makes it so much easier to manage and to understand where you have opportunities and also understand where you have bright spots. And then you can go take care of the ones and thank them for all the work they do where you see them doing a great job, and where you have opportunities you can go course correct when necessary. So it's great.
So we're looking at the ledgers. We're looking really close at the ledgers because that's really where it is at, and that's where your accounts receivables, your clean claim rates, and that really will filter the profit to the EBITDA. So that's what we're really looking at.
Another imperative that we have that we've had great results with is GBT, so guided biofilm therapy. And so we are making the decision to implement that across the chain too over the next couple of years.
Well, the one thing we want to do is to be able to integrate different softwares into our software. So that's even our AI, we want to be able to integrate that. Some of the other programs out there, we want to be able to integrate that. So that's become a big issue. Now, we don't want somebody that's all proprietary. We want to be able to have that openness with our software.